Hello, you're watching Rizal's ASEAN with me, Rizal Zulkapli, and in this week's episode of Rizal's ASEAN, we will follow the journey of two Malaysian doctors setting up a hospital in Cambodia to provide healthcare facilities to the underserved Cham communities in Phnom Penh. With me, Rizal Zulkapli in Phnom Penh. The first hospitals beyond boundaries were set up in Phnom Penh, Cambodia in 2012 by then medical students Dr. Wan Abdul Hannan, Wan Ibadullah and TN50 Ambassador Dr. Mohd Lutfi Fadil. HBB started as a mobile clinic before expanding to become a community clinic for the Cham community in Phnom Penh. Dr. Lutfi was unavailable as he was in Harvard University in Boston studying public health. Let's start with why Cambodia? Why did you choose Cambodia to start HBB?
What happened was that me and Lutfi, we were fourth year medical student at that time. We went for medical student conference in Mumbai, and one of the activity was they brought us to one of the slums area. What ignited us was that there was a hospital built in the middle of the slum area, and the hospital is run by the local community. So it's empowerment of the community, and the healthcare is taken care of by the government through the community. So that is one. Another thing is opportunity. And then when we come back to Malaysia, what happened was that there was this one ustad called Ustad Kausar came to Malaysia to give talk and fundraising regarding the school he wanted to build for the Cham people. But what catch our attention was that because we from medical backgrounds, so what happened is that we asked regarding medical problems, and it seems that the Cham people here is so-called underserved in terms of the medical treatment and all that. So we thought this could be the opportunity for us to build a hospital here in Phnom Penh.
So how do you sustain your operations here in Cambodia?
All right, HBB, one thing I need to tell you guys that HBB is not a total charity hospital, which means every patient comes, they have to pay. They have to pay for the services. It's just that how we try to sustain ourselves is just that the community themselves are helping each other through cross-subsidization. So as you can see around here, rich and poor people, they live together. So the socio-economic gap is very huge between the rich and the poor people. So we opened this hospital for all. Rich can come and poor can come also. So what we did is that the profit for every 3 patients who could afford the services will cover for 1 patient who could not afford the services. So that's how we sustain ourselves and try to not to sustain through donation, continuous donation.
We spent one day at HBB looking at the range of treatment services provided for patients and the community around the area. HBB is now equipped with its own maternity hospital to ensure quality healthcare for mothers and their infants. You mentioned that the community faces difficulties when they go to government hospital. What are some of these difficulties?
It is not all the time, but in the government hospital, the service is still limited. I think the government should be try to improve more, especially Cham people. They have many problems faces in the government hospital, like costing. Where is the place to pray? Some of the doctor, they are not really friendly with them. The medical staff also. So this is what our HBB much different from other.
And what kind of treatment do you provide for the people in this community?
We see a lot of cases, and most of the cases mixed. This infection problem, this chronic disease. But here we divide. The severe case and major case, we advise them and we refer them to the government hospital. And most of the cases that we can manage, we treat here, like some infection, diarrhea or high blood pressure. Diabetes also is a common case here. Some of tuberculosis we still meet here also. Yes.
You also go to their houses in this community to provide them with public health education to an extent. Maybe you can share with us about that.
HBB it's very, very different from other. We are not only give a treatment, we are not only give the antibiotics, but also we go to see and then educate them, educate the patient and also the whole family of the patient to eating good, sleeping good, the hygiene as well. So I think this is a big part of public health.
On the way from the airport to the hospital, I noticed a lot of initiatives created by the government of Cambodia with other governments from across from around the world. You've got the Japanese government and many other governments contributing to the development or to the setting up of organizations and also facilities to support the Cambodian government. Share with us the importance of that, especially when you have two doctors coming from Malaysia to help set up HBB.
Actually, Cambodians still needs more support, especially in terms of the technology, financial services. So HBB camp, it is a good time for us. It's not only for the community, it's not only for the patient, but also for the medical professional like us as well. So like me, Dr. Maro, and also the other staff, we have a good opportunity to learn more, to improve more our knowledge, our skill, our technology as well. So I think this is very important.
Rizal's ASEAN also conducted an interview with Dr. Lutfi, who was selected by the United Nations as one of the 16 young leaders for its Sustainable Goals Initiative via Skype to find out how he intends to discharge his role effectively as a TN50 ambassador. Hi, Dr. Lutfi, thank you for joining us. Now, the first question is on HBB. After years of operating, what changes to the lives of the people around HBB have you observed and have you made?
Because when we started HBB, it's just a barren land with just one hospital clinic there. But now we see a lot of schools and roads are being built, because whenever you build a healthcare center, it will be like a community center for the people there. So it's just not just improvement of the health of the people around HBB, but also social, economic conditions of the people around.
What's the biggest challenge when it comes to running and setting up HBB, and how did you overcome that challenge?
I guess the most obvious is about funding, in which when we started, we were just medical students. So it took quite a while for us to convince the public to donate for our cause. And even after building the clinic and the hospital, the second challenge would be trying to implement quality healthcare in a place where there used to be no healthcare at all. So the culture of seeking medical attention, this culture of seeking modern medicine, especially, is quite low. They're still used to seeking help from traditional healers and alternative medicine that are proven not to be effective. So getting our first few patients was quite difficult in itself. So it's about changing their culture and making sure that we are not being seen as an outsider and trying to take away the local market.
So what's next for HBB? Do you plan to expand the model to other countries in Southeast Asia?
I see that our focus now is on doing and improving our one clinic so that it can be replicable elsewhere. Because I guess that there's no use of expanding to many places, but you're having a low quality healthcare. So right now we're doing, because we do things by learning from mistakes, right? So from there we improve bit by bit until we're comfortable enough financially and also in terms of protocol, the medical protocol, that until we can replicate it elsewhere. But our long-term vision is to start expanding outside of Cambodia, first with Southeast Asia, and inshallah the world.
But I think one of the questions that have been dying to us is why Phnom Penh? Why not create equal access or increase access to healthcare in Sabah and Sarawak?
And why we didn't build in Malaysia yet? Because it's a pilot project, and I believe that a private project must be viable because it's all or nothing. If we fail during the first pilot project, then it's less likely that we'll be able to expand it elsewhere. So in Malaysia, we have a very good health system, to be honest, and our government's health system is almost free. You only pay RM1 and you can get everything. So for the poor people in Malaysia, the first place that they would want to go is the government clinics, which only charge RM1. So there's no incentive for them to go to a clinic that charges like the private clinic. So there's no good balance between the rich and the poor. So that is why we think that the model could only work in a place like Cambodia, where even the government clinics are paid out of pocket.
And Dr. Lutfi, you're studying public healthcare at one of the most prestigious medical schools. What changes do you plan to make when you come back to Malaysia?
So the healthcare equality that Malaysia should go towards is of bridging the gap between private and public healthcare, in which the share of the burden of disease should be shared between public and private. And I believe that the private sector should also play a role in public health instead of just giving healthcare in clinics and hospitals.
And these days, there are many young doctors volunteering on weekends to increase access to quality healthcare in the rural areas in Malaysia. And what do you make of that? And are you hopeful because we have all these young, bright minds serving the nation right now?
Yeah, I believe it is very impressive that the Malaysian youth are very active in volunteerism. They do this for no payment, they volunteer for weeks and sometimes months. So I believe that the spirit is there, and we should encourage them by providing them with the facility, providing with the training, so that they can use all of this passion for a good cause. So it is hopeful. I see that it is hopeful that Malaysian youth are doing all these things. And I guess in the future, any programs that would like to utilize volunteers, especially among the youth, wouldn't have a short supply of them.
And as one of TN50's ambassadors, how do you inspire the youth in Malaysia to go beyond and to serve the nation?
I guess my role as a TN50 ambassador is a bit different than others because, as you may know, I'm already in the United States studying for my doctoral program, and the message that I'm able to send to others is that you can always advance the country by the pursuit of knowledge, even though you're not physically there. So right now, like in the US, everything that I've learned, I've put it in the back of my mind and in my heart that I want to implement whatever I've learned here back in Malaysia, although currently I'm not physically there.
And that's all the time we have for this week's episode of Rizal's ASEAN. Tune in to Rizal's ASEAN for more insights into the bright young minds in Southeast Asia, especially the young minds trying to make this region a better place for them to live in. This is Rizal Zulkifli for Rizal's ASEAN, Phnom Penh.